Can we go ahead? Okay, all right. Good morning, everyone, and thank you, sir. Can you guys hear me okay? I can talk much louder, and I tend to wander as I talk. Thank you all for coming in this morning. We'll keep it pretty informal. If you guys have questions, just ask. And I will introduce myself. I'm Dr. Hallie Hasel. I am the new state veterinarian, following in some large footsteps left by Dr. Jim Logan, who retired in July of 2021, lost track of years. Retired in July, and obviously this is his home, he's still here. And he is still very active in working with different projects within the livestock board and outside of it as well with the sheep folks. So following in his footsteps, if you have any questions, please let me know. A little bit about my background so you know where I come from and what my experiences are. I actually graduated from the University of Missouri, but worked in western Kansas for about 20 plus years on the Kansas-Colorado border. Had the clinic there for about 15 years and then went to work for USDA, but did relief work on the side. We raise Red Angus, so I'm a Red Angus fan, raised Red Angus in western Kansas. Primarily a cow-calf person. After I sold my clinic, I thought I'd have a little free time, which was a mistake, but I went to work for USDA and as a field vet in western Kansas, and then moved to the great state of Texas, to Austin, to serve as the USDA area veterinarian in charge of Texas. And then I moved down to Laredo and spent 7 years between Brownsville, Texas and Del Rio, Texas as the director of the USDA cattle fever tick program. So if you have any border questions, let me know, and it's definitely a unique environment. That program has about 126 cowboys, and they're an interesting group to work with for 7 years. And they teach you a lot about border life. So spent 7 years down there, decided it was time to come back a little closer to home, and so moved into Riverton and was the field vet for about a year. Then when Dr. Logan retired, I was hired as a state vet. So it's good to be here, thank you. And a little bit about, and that's my introduction, so save you from all of that. So a couple answers, well, can you guys see that? Oh, not very well, but I may have to turn the lights off in a little bit. But as most of you may know, we'll see if that helps. Yeah, that helps. And if you take a nap, I'm good with it. It's okay, just don't snore. But a little bit about where are we? So a lot of you know that the Riverton office is closed. Our sign is still there, but we no longer operate out of the Riverton office. And that was closed towards the end of last year when Dr. Logan retired. And the reason for it was that with the technology that we have today, we don't need an office building for somebody to work. Our field vet can work out of their home. We have our technology, we have our vehicles, and besides that, they're never in the office anyway, period. And we would average maybe one person per week, maybe, to come into the office for an actual in-person discussion. So we decided to go ahead and close the office here in Riverton, and all of us are in Cheyenne as far as the main livestock board. And when I say all of us, and I apologize, I'm getting over the crud, so my voice is off, but when I say all of us, I mean myself as the state vet. We have an assistant state vet, Dr. Brad DeBro, and he is out of the Cheyenne office as well. And then we have our administrative health staff, which is Doug and Lindsay. Some of you may have talked to them. And then we have another admin position and another vet position that are vacant right now. So the field vet position that I vacated will be located somewhere in western Wyoming, somewhere. Now I'm not saying they'll live in western Wyoming because when you hire a field vet, you basically hire the family. And they have to have housing and they have to have jobs. And if they have a spouse that is also a professional person, I can't put them in Big Piney, Wyoming. It doesn't work very well. I can't put them in Wamsutter, I can't do that. So I have to kind of work with them on where it'll meet their needs. So we will have a field vet. Their responsibility is western Wyoming. That might live in Laramie, I'm not sure, but they'll be up here quite a bit. So we are looking for a field vet right now. Unfortunately, those positions are pretty hard to fill. It's been open for a few months, about 6 months, and I think I've had 4 applicants, maybe. But that's not unusual, especially in the job market today. And I can also tell you that about 3/4 of the states in the United States have field positions open, and we're all having the same problem, unfortunately. Something else that's kind of interesting is that over the last year, of the 50, basically 50 state vets across the U.S., 30 of us have joined or have started as state vets in the last year. So 30 states have new state veterinarians right now due to the retirement situation. So if we have any questions, please holler and I'll just keep moving through. So we are in Cheyenne. The field vet will be somewhere in this region when they're hired. We'll make sure to get that out to everybody. But if you have questions, just call our office, email us. We're always available. You guys have the brand inspectors here. You can holler with them to get a hold of us. We're always around, so don't hesitate to holler at us. And if we need to come up here, we do, on a regular basis. Typically, one of us is in the region almost every other week, if not every week. So just holler at us, okay? All right. Okay, so just a little bit about the DSA. And I hesitate to say a lot because I know that most of you are familiar with what the DSA is. But people ask, what do we do at the state vet's office? What's our responsibility? Well, in Wyoming, a big responsibility that we have is a designated surveillance area. And why is that important? I get that question a lot, surprisingly enough. Why is it important? Our goal as a state vet's office, is to keep cattle in Wyoming marketable. And that might sound odd. I know we have good cattle and we have excellent cattle. But if they have brucellosis, their value drops considerably. So our goal is to make sure that we don't have that problem, that we keep our cattle exportable because we are an export state. And we need to keep brucellosis out of our cattle herds. That's our goal. So the designated surveillance area is where we have the highest risk of brucellosis within our livestock herds. And it's primarily due to elk. We all know that. We don't have an answer for the elk. We love the elk dearly. And in the last 10 to 15 years, there have been a lot of mitigation efforts made to really decrease the risk in our herds. Whether it's through fencing, whether it's through hunting, vaccination, booster vaccination of our cattle, it's made a huge difference. And because of that, we haven't had any major issues in several years, and I hesitate to even say that. But we haven't. We will have a quarantine herd occasionally, yes, that's not unusual. But now when we have a quarantine herd, it means that we take out that animal that is brucellosis positive. We test the herd about 3 to 4 more times, which is about a year to 2 year process. And that's it. We don't take your herd. We don't kill all your cows. We don't do that anymore. We take the positive animals out. You are quarantined, but that doesn't mean you can't sell anything. Doesn't mean you can't slaughter anything. Yeah?
I have a question about your vaccinating the cows again. So you're talking
Yes.
about a revaccination. Does that give them a real high titer that might trip a false positive test? I'm just curious.
No, and it's the vaccine versus the test are a little bit different.
Okay.
Okay? And what happens is we go ahead and we do the calf foot vaccination, by 12 months of age. In some areas that are high risk, we do a booster heifer vaccination at least 6 weeks prior to breeding. And then we vaccinate the adult every 3 years.
Huh.
And that's based on scientific studies that have shown where that level of antibody titer might be. So no, it does not.
Okay, thank you.
And to add on to that, all female cattle coming into the state of Wyoming are required to be brucellosis vaccinated. Does that cause issues? Yes. And the reason it causes issues is that there are only basically about 5 states in the United States, and don't quote me exactly on that, it's somewhere in there, that require brucellosis vaccination. 3 of those are the DSA states, so Idaho, Wyoming, Montana. The rest of the states in the U.S. do not, because brucellosis is not a problem. It's not an issue. So most cattle that are imported into the state are not brucellosis vaccinated. We recognize that. That's fine. What happens is they have a adult booster vaccination requirement when they come in. So those animals are quarantined until they're vaccinated as an adult when they come into the state. And by quarantine, it means they stay on the farm until they're vaccinated.
If you vaccinated the pregnant cow, would it cause her to abort?
So that's my next point.
Oh, thank you.
So knowing that most of them, when they come in, are they're either going to be bred as a heifer or they are usually pregnant, they're quarantined to the place until they calve, and then usually in May we'll make sure that they're vaccinated prior to breeding. We do not encourage vaccinating an adult animal that is bred. We do not encourage that. You can. It's your risk for abortion, yes. So we do not encourage it.
Okay, thank you.
So we have herds come in that might be 50 head or more that are not vaccinated. That is fine. They just have to stay on their premise until they are till they calve and they can be vaccinated.
So is that just enforced via the honor system, or how do you guys?
No, yes and no. We have a reminder system. So everything is officially quarantined. They get a quarantine letter, whole 9 yards. Typically in April or May, we'll start getting hold of those folks saying, hey, are you vaccinated? And also their veterinarian has to sign their vaccination waiver form before they can come in. So we hold the veterinarian basically liable. And then we also hold the owner liable. We occasionally have some issues, and honestly, it's some of our dairy folks that we have issues with. Is anybody in here a dairy person? Okay.
But I don't bring cattle in, I
All right.
send them out.
So the biggest problem we have is the dairy folks, actually, because sometimes their calving intervals aren't quite the same as a beef person. They're a little more sporadic, which we understand. But we have a reminder system. We go back and haunt you until it's done. Does it require compliance? Sometimes, yes, it does. But for the most part, they're pretty good. Yeah.
You might tell them about the surveillance that the dairy folks are under though, with the ring test. So we're not getting away.
And that is coming up as well too. Don't let me forget that one. Somebody have a question?
Yeah, you welcome us to call, okay?
Yes.
I wanna know what's appropriate for us to, as an animal person, what's appropriate for us to call you about, and what should we not call you about? That's a hard
If
question.
you call me to complain, have an answer.
Okay.
Okay? If you call me to issue a complaint, have a solution. That's my request.
Okay,
You can call and complain about anything you want. I'll listen. I may not do anything about it. I may not be able to do anything about it, but I will listen. Anything that's animal health related, call. Wildlife animal health interaction, call.
okay.
Just to say, hey, what can we do to help you as a state vet? Call. And my job is to say to you, what can I do to help you as a producer? Does that narrow it down at all?
Mhm.
Maybe kind of?
No, it does.
So anything that's animal health related, call. And that's my next point kind of too. So we monitor import export into the state. That's another big job that we do at the state vet's office. We set the regulations for bringing animals into the state of Wyoming, and I'm talking livestock, although rabbits are livestock. We set those regulations. And as far as export, we work with all the other state vets to determine a lot of the export rules that are out there. We represent the state of Wyoming with all the other state veterinarians, with any disease issues, with USDA. I was with USDA for 18 years before I came to the state. I have no complaints whatsoever. I just needed to come back to the Midwest. Or I should say the Midwest, Midwest. Anyway, that's what we do, is we do a lot of the politics in Cheyenne, which is not something we enjoy. And that's something else I would say too, is that if you see an animal health issue or a rule that's out there and you don't like it, let your legislators know that too. Because sometimes we can't change it without their help. Or they want it, we may not like it, but we can't change it unless you complain about it. So keep that in mind. So we have the DSA because of our high brucellosis risk in those particular areas. One of the things we're looking at or we're doing is all of our rules right now as far as Wyoming Livestock Board animal health rules. We go through those about every 3 to 5 years. Excuse me. I'm trying to get through this. And we're updating those right now. Yes.
Is Colorado a brucellosis state?
They require, yes. I say yes and no because they're changing their rules right now. So if I tell you yes today, it could be different in 6 months. So that's where I'm,
Do they have the?
they don't have
They
a,
have the elk herds in northwestern Colorado. I just wondered if they had the disease.
no, absolutely not, no. They don't have any of the Yellowstone issues that we have. They don't have the wildlife interaction that we have from the Yellowstone area. They don't have the big parks to worry about that we do. Yes, they have Rocky Mountain National Park, but they don't have the issues of the Yellowstone region that we do. Yeah, so no. They do require vaccination, but a lot of that is changing. So as I mentioned, there are 30 new state vets. When you get a new state vet, you look at all the rules. So there are at least 30 states right now that are redoing all the rules. We just had a call yesterday with a bunch of us because we're trying to make them as uniform as we can across the United States, but keeping in mind that every state has a different risk for different diseases. So yeah, a lot of that is changing right now. Trying to make it easier for the producer, but yet protect our state's assets as well. So, but we're looking at all of our rules. So if there are some rules out there that you question, with regards to brucellosis or trichomoniasis or whatever else, then tell us that. Call us and discuss it with us and let us know, but give me a solution to it. Okay? Brucellosis updates, I kind of went through that. If I didn't talk a little bit more about brucellosis, Dr. Logan would haunt me. So, has anybody in here had it in their herd?
Long time ago when I was a kid.
Have you ever had it?
No.
Okay. So brucellosis is a zoonotic disease, meaning it can be transmitted between people and humans. It's called undulate fever in people. Many of us as veterinarians have high titers to it, unfortunately. Before the vaccine we have now, it was a much stronger, a little bit different type of vaccine, and that could cause titers in people, which a lot of us have. So what is it? What does it cause? It is a disease that causes abortion in cattle, elk, and bison. So the biggest risk for your cattle to contract brucellosis is during the elk calving periods, which we typically assign February, end of February through early May, end of April, early May. Okay. So contact with elk outside of that period doesn't carry the same risk as it does during calving season. The bacteria are shed whenever they abort, and cows being cows, they have to go check out the entire placenta and everything else afterwards, and that's what causes the infection, is that contamination, the inhalation of it. But it doesn't just cause abortion. You can have brucellosis in a herd that basically just has a low milk production. They aren't as thrifty. They have a little bit of arthritis, polyarthritis in the cows. So it doesn't necessarily have to cause abortion. And I will also mention that the vaccine, one of the primary advantages of the vaccine is that it may not protect them completely from brucellosis, but it protects them from abortion. So can a vaccinated animal get brucellosis? Yes, they can. But they don't spread it as much, and it protects them from abortion if they're vaccinated. Okay. We don't have a good vaccine for wildlife. You guys know that. But there are ways to mitigate that risk of interaction with the elk. So if you do graze in a DSA, we just ask that during elk calving season and during your calving season, you make sure that you keep them separate. Wyoming Game and Fish is very, very good at doing surveillance on the elk. They have a very good idea of the different herds, seroprevalence of brucellosis, the different elk herds across the U.S. They have a pretty good idea of what that is in each area. They focus on different hunt units each year to determine what that surveillance or seroprevalence level is. And I'm anxious to see, so this hunting season that we're in, they focused on some of the elk in eastern Wyoming. And I'm really anxious to see what our numbers come back as from those elk herds. I hope it's like 0, but we'll find out. So go from there. Any questions about brucellosis and why we emphasize it so much?
How are they doing the surveillance on the elk? Is this when they're doing the blood test or blood sample?
Hunter harvest.
The hunter
It's all
harvest.
voluntary hunter harvest, yeah. Yes, sir.
Well, now that they got the great lab started again in Laramie, will there be some discoveries coming out of that lab with brucellosis?
So here's the topic on that. What we need for brucellosis research is the ability to use an outdoor lab. Currently, brucellosis is considered, I've lost my words. It's on the bioterrorism list. So it cannot be used in the outside right now because it's on that bioterrorism list. We're not allowed to use it in outdoor research. We in the Greater Yellowstone states have applied to the federal government to have that released from the list so that we can do outdoor research. They've said that they'll release it. They told us that 2 years ago, but they haven't done it yet. So the labs would like to do the research, but unless we have approval to do it outdoor, to make it a more realistic setting, we can't get that research done. As long as that is extremely bad, and we have fought very hard for that. And I will mention that Dr. Marty Zalewski is a state vet in Montana. He's been there for a long time. Marty's very opinionated. Marty's very strong about his feelings about brucellosis and research. And he has been a one-man show in a lot of cases with our federal government to try to get that released from the list. And we're all back there supporting him, but it's been tough.
But I don't know, you know, you realize, but I don't think a lot of people realize it's such a worldwide problem.
That is correct. And unfortunately, in the United States, well, fortunately and unfortunately, it's just the 3 states. But outside of the US, it is a large problem
But there's a lot of ungulate fever
in other countries.
in other countries. It is still a people
It is.
disease.
And people don't realize that. Yes, you're correct. The research still needs to be done. It's just that in the US, we can't do it because it's a bioterroristic agent. We don't think it should be classified as that. There are much easier agents to access and that are much faster in the effects that they cause. But trying to get that off the list has been a real battle. Yeah. Any other questions about brucellosis? And if you're not doing your calf-led vaccinations at 4 to 12 months of age, and we find you, we will come talk to you and hound you and make you understand why it is so important. Because if we export cattle out of this state that have brucellosis, I can tell you that our ability to export our cattle beyond that will be extremely difficult and extremely costly to the producers of this state. So yes, this part of the state bears the brunt for the entire state, but it's our responsibility to do that. Questions? Okay. Just a little bit of information for you guys, and I feel bad because you might not be able to see this very well, but where did we get our brucellosis numbers? Our surveillance numbers. So we're just now finishing up our 21 data. But that kind of tells you typically, annually we have between 80 and 100,000 animals that we test, which is about the average for Wyoming. I think for 21 it's going to be close to 90,000 tests that we have. The biggest chunk of that comes from the designated surveillance area, obviously. You'll see that in the kind of the orangish color. Then we also have it from ranches outside of the DSA. So you might ask, why do ranches outside of the DSA test for cattle? Well, a lot of cattle grazing in the DSA, their home place is outside of it. They may live in Sheridan or Gillette, but they graze in the DSA. So that's what happens there. And a lot of folks just want to know. We have a lot of purebred breeders that want to make sure their herds are clean before they sell. And then, of course, we have our slaughter plants and then across the entire state. So we test between 80 to 100,000 samples per year.
So there's a movement in the state of Wyoming, and I guess across the country several years ago, to movement to require every animal be registered, okay? That suddenly left, and I have to left or no one talks about it anymore because I don't think the ranchers want to do that.
So that goes back to premise registration, and actually it is still out there. It's not required in Wyoming, but a lot of states premise registration is required. Required in Colorado, Kansas, several other states, it is required. And that relates back to something I talked about last year, and I didn't want to bring it up, but I will, but since you mentioned that, is animal disease traceability. And the point of the premise registration was to track our animals as far as disease movement, disease traceability. That's the point of it. And that goes back, guys, I am so sorry. That goes back to tag management. I know some of you guys are using RFID tags. More than you would realize across the state. Well, I don't get the complaint, do I have to use it? I get the question, can I get more free tags? Which is great, I love that question, and I'll do my best to get those for you. But that relates back to the tags, our RFID tags, and animal disease traceability, and that's what premise registration is. We need to be able to monitor disease across the United States. Animals move so quickly anymore that there is no other way to do that without having an electronic system to monitor movement. So when you use RFID tags, you can get that data in a heartbeat. You guys have it. If you give it to us, we have it in a heartbeat. We know who's what, where, and when. It's about disease traceability, not about the person themselves. The animal disease traceability rule was just about ready to go into effect when we had a new presidency. And each time you have a change in government, they stop all the rules so that that administration can review them. That's policy for every president that comes in. So the ADT rule got put on hold. It is back. It should be passed this spring, which would require mandatory identification of things that are being sold. And that identification will be required to be an electronic identification capable of being transmitted electronically. probably go into effect late this spring, early fall. That means when you sell an animal or move an animal or change ownership, that animal has to have electronic identification to do that. Okay? Most of our producers are already doing that. I don't think it'll be a huge issue for us. But that goes back to disease traceability and premise registration. Wyoming does not require premise registration. Okay? That's a confusing answer.
Is that applicable for all species or just cattle?
Livestock, so cattle, goats, sheep, rabbits have to be microchipped to be vaccinated. But yeah, livestock. And each different age of species kind of varies what they have to have, of course. Feedlot cattle are required to be individually ID'd yet. So there's different requirements in there. Yeah. But it's coming, and I don't see it changing the way we operate because we're already doing it. And as far as calfwood vaccination, you can use the orange RFID tags, you can use the white RFID tags. Calfwood vaccination, if you're using an RFID tag, it doesn't have to be orange for that RFID tag. It just makes it easier to see that that animal has been vaccinated. Did that answer your question? Okay. Typically, I have a strong, loud voice, so I apologize. One other thing that we do for brucellosis mitigation in this state is we have a herd plan. And if you work with us, we'll develop a herd plan for you, which tells you the things you can do to mitigate brucellosis in your herd. It also approves your veterinarian to be reimbursed when they booster vaccinate your herd or when they test your herd. That significantly decreases the cost for you. And that's the biggest part of our budget, honestly, is brucellosis reimbursement for veterinarians. So if you have that herd plan in place, we can help you out with those costs. That's the bottom line. We can also sometimes do waivers for you. For example, if you live outside of the DSA, but you graze in the DSA, you have to test your cattle before they come out. If you can't get that done, if you don't have corrals there, we can give you a waiver to get it done at your home place. But you need a herd plan in place to do that. It doesn't cost you anything. It's totally voluntary. It takes about 30 minutes of your time, but we can do that for you. And we'll help you out with that. And that's, I don't want to say it's our premise registration, but that's also how we know about how many herds are in the DSA. And we're required to know that to keep our surveillance numbers up. Okay. I'm going to switch species here for just a minute and try. We've been passing the crud around our office.
Ma'am,
Mm-hmm.
would you like a couple cough drops?
I have some. I'm just afraid I'll be talking and then I'll choke on it while I'm talking.
Spit my mouth.
Exactly. I had some throat lozenges and I know I'll choke on it. But thank you for the offer. Who has chickens? It's okay to have chickens? It's good? It's all right?
Chicken, sheep, and goats.
Okay. Chickens are kind of a backyard commodity no matter where you live anymore, honestly. But you may have heard yesterday and for the last couple of weeks that we have avian influenza in the United States again. This is a big deal, folks. It really is. If you look at the cost of meat and chicken and turkey, if we have a high AI outbreak, it's going up, all right? And why is it important to Wyoming? Well, let me show you something else. We are not a huge poultry state, obviously, but we have backyard flocks. We have backyard breeders. We have poultry buses that move things across the state, and yes, that is illegal, I might add. But we are in a flyway. All the United States is in different flyways, okay? Avian influenza is transmitted typically by wild birds, usually by ducks. And they don't typically get sick. They don't get sick from it. But we are in a flyway. The east and the west are in different flyways, but we are definitely there. For us, my biggest concern is the eastern part of the state, but avian influenza is back. And I ask that you be aware of that. That if you have a sick chicken, and a sick chicken, I mean, they have a cold. They have a kind of a snotty beak. They have watery eyes. Their comb turns blue. Or you just find them dead. They go off feed. You might lose a couple. You could lose your entire flock like within 2 days. Call us. We'll come out and do an animal disease investigation. It is no cost to you at all. Zero. Other than you have dead chickens. Okay? Call us. We'll contact USDA. Either us or USDA will come out to your place and get your dead chickens and do a disease investigation. We want to know what's there. Some of you may have seen that we do avian influenza testing at our county fairs. A lot of them, ones that are in a high-risk area. And all it is basically it's kind of like a COVID test. We just go in and we swab the little slit in their mouth. That's it. That's all we do to check for avian influenza. We do it at most of the county fairs on chickens and other poultry, just as surveillance purposes. That's all. So if your chickens are dying, if you have one or two, that's fine. Call us. We'll come and collect that chicken and send it in for avian influenza testing. Okay? Really, really big deal. You might also note that USDA has what they call a Defend the Flock program. It's a website. It has all kinds of fantastic information about how to defend your flock, how to keep it disease-free, what kind of testing is out there. It has some great stuff for kids on there. And that is a big thing right now. So please go on there and learn how to defend your flock. Okay? And it call us with chicken questions. Okay? I am not a chicken vet by any means, but call us with chicken questions. Your vet may tell you to call us because they don't want to deal with it. Let's switch now to horses, and this slide changed a little bit. I'm sure some of you in here have horses, just a couple of you at least. Okay. So, and my slide shifted this morning, I don't know why, but anyway. Coggins, EIA, equine infectious anemia. These are the states as of 2021 that had EIA. And you may say once again, why does Wyoming care? Do we have any folks that come into our state but their horses from out of state?
Lots of them.
Absolutely. Do we have any dude ranches? Do we have any rodeo finals? Do we have any of that? Absolutely. So it is important. Of course, Texas has the highest risk. Most of that is because of horses that come across the border, legally or illegally. And yes, it does happen. So that's just kind of letting you know where it's at that we've had some positive cases. Is there a treatment for EIA if your horse gets it for Coggins? No, there is not. That horse is either quarantined for life from all other animals, all other horses, or we have to euthanize it. Okay? But what gets into this a little bit more, my point of this conversation, are some of these numbers. So, and I'm not against racing, I want you to know that. But if you look at the EIA trends that we're seeing from 2013 to 2020, the number of EIA positive horses that we have and the number of those positive horses that are race horses. What does that tell you? Yes. Do you have any idea why we're seeing so much EIA in our race horses?
They travel.
It's part of it. What was that one?
Proximity to each other.
That's another part of it. You guys are on the right line there. We have a lot of illegal racing now in the United States. There are more illegal tracks, what we call bush tracks, than there are legal tracks in the United States. And in the illegal tracks, the dirt tracks, the bush tracks, there are no laws, there are no rules, nothing is out there. Doping is extremely common, and we recognize that, except when they're doping, they're not using clean needles and syringes. They're reusing the same needles and syringes. And those horses will compete in bush tracks in the off-season, they'll compete on our sanctioned tracks during racing season. So they go back and forth. And we know this because everything's on Facebook. All the bush tracks are on Facebook. You can find them out there. You can watch the horses run, and then you see them back. And we're not talking about horses that come straight out of Mexico. We're talking horses that come out of Kentucky. We're talking about expensive horses that are on the bush tracks. Okay? That's what's causing our numbers to increase. But then we get into pyroplasmosis, which can be considered a reproductive disease, but that is also spreading across the United States. It's transmitted by ticks. And unfortunately, we see a lot of horses that have both pyroplasmosis and EIA. And the reason for that is the doping. And what I want you to notice in this one is that out of the 526 positive, 467 of those are quarter horse race horses. So does Wyoming have racing? Yes. So this is something that we need to be aware of because it's out there. Okay. EHV1. Anybody know what this one is? Equine herpes myeloencephalitis. You may have heard about it because EHV1 is coming across the United States quite rapidly. We have an outbreak of EHV1 around the Cody area right now. Okay? And we typically have an outbreak in Cody. We see it a lot around Gillette, Sheridan. We see it in those regions. It's not unusual. There is not a vaccine that covers the neurological form of this disease. And what you'll see is a horse that has a lack of tail tone. They're weak in the hind limbs. They may kind of weave when they stand. They'll do head pressing, and they kind of wobble. They're off balance. And there's not a good treatment for it. If they have the neurological form, they can survive, but it is expensive. So we do have an outbreak of it in Cody right now. I want you to be aware of that. Some of them will live, but there's also EHV4. There's also the respiratory form, which is very common. They can recover from that. And there's also a form that causes abortion. So you'll see like Rhinobort, Rhinomune, those are some of the vaccines for EHV4. There might be some cross protection for EHV1, but we don't know that for sure. There's not a good vaccine. Anybody ever seen this or have questions about it? It's out there. Be aware of it. Okay. So like I said, we have it pretty heavily in the Cody area right now. Part of that is because of all and I don't blame it on the dude ranches, but part of it is because of all the dude ranch horses that are in that region. They come in from all parts of the U.S., and so they congregate a little more heavily in that region.
Would that cause a horse have difficulty eating, like controlling their head and neck movement?
It can, but it's a short-lived thing. If that's a chronic problem, no.
Because I've seen a horse north of Riverton do that. It was like he couldn't put his head down to eat. He kept trying to put his head down to the ground to eat. and he
It
couldn't.
can.
Has he just been vaccinated? Because I've seen that.
I have
If they're
no
sore.
idea.
Yes.
I just drove by him one day.
But they will go down, and these are not the best pictures, but they'll sit. They'll have the runny nose. Of course, they keep them hoisted once they do go down. It's not a pretty thing to watch. Have you guys seen horses with West Nile? Anybody seen that?
Yeah.
You know, they go down. It's not a pretty thing to watch. They might recover, but it's rough. It's very similar when you see it to an EHV1 neurological horse. West Nile has a good vaccine, EHV1 does not. And it will spread. The horses that we have now, there was about, he didn't know exactly how many horses he had, between 40 and 50, somewhere in there. I think we've lost around 8 to 10 probably. I think it's run its course, but it'll hit pretty hard. It's an expensive disease. And then I'd be amiss if I didn't mention vesicular stomatitis. I'm sure some of you guys have seen that, more than you care to see it, but that is another disease of our livestock. We have it most commonly in horses, but it causes blisters around the coronary band, on their tongue, their gums, their cheek, their ears, their muzzles. They are spread by flies, can sometimes be mosquitoes as well. Typically will occur in the spring, summer, fall. It's about this time of year we'll start seeing it in southern Texas. We had it in Laredo area right before I moved up here, and I was threatened with my life if I brought it with me. But you'll see it come in through spring and summer. It does not have a treatment either. It just has to work its way through. And what we see, frothing at the mouth, lameness, but you see blisters. I mean, they're like the surface of their tongue just kind of falls off. And they get scabs in their ears and scabs around the coronary bands. The big thing is we cannot distinguish that in cattle from foot and mouth disease because they're blisters. In horses, obviously it's not foot and mouth, but if cattle or swine get it, we don't know. So if you see it, call us. We'll come out, we'll do testing. No cost, 0 cost to you guys. Bottom line here is if you have a disease that you don't understand, things are dying, call us, call your vet will call us. It doesn't cost you anything, okay? All right. And there's some pictures of that. Also, they're not very good, unfortunately. But they get big blisters. They slough parts of their tongue. That's literally what the horse's tongue looks like. They will survive, but it's very painful. They lose a lot of weight. And I think that kind of sums up. Sometimes you only see it in their ears. When we had it in Texas, we had it in cattle and horses. And the only reason we would pick it up is when our folks are checking for fever ticks, they have to check around the udder. And all these cows had teat lesions. Nothing else but teat lesions, but they were massive teat lesions. And that's vesicular stomatitis as well. Questions? I'm done making you guys listen to me cough and hack. Any questions?
We've all been there.
I'm sorry.
I was late. Did you go over scrapies and sheep and goats?
I did not this year. I did not. Do you have questions I can answer for you about it?
I was mostly wondering about if I was to buy sheep or goats from out of state and bring them in, you know, how to bring them in legally, or can they be brought in and then tested at my premise, or do they absolutely have to be tested, et cetera, before they cross the state line?
So I will tell you that just yesterday we revised our scrapie rules, and will be in effect another year or so, but we're changing our scrapie rules.
Okay.
We're taking away the black-faced sheep requirement out of the scrapie rules.
Okay.
They have to have ID, scraper tags, to come in legally. That's number
Yeah.
one, okay? And then it just depends if you're bringing in rams, if it's a BOS type test, or, but as far as scrapie itself, no, they don't have to be tested for that
Okay.
at all. There's not a really efficient live animal test for that.
Yeah, and I was thinking, you know, like the ram test or.
The BOS, that depends on the age and all kinds of other things. It's very well outlined in our rules, and I forgot to mention this. The rules go over the testing that's required, and we are getting a new website, amen. We're getting a new website. It will take a few months to get there. I'm excited about this. And it'll be much easier to find our rules and to find us and all those things. So it's coming, but it does take time to develop it. The rules are on there. Just go look them up or give us a call. We'll send them to you.
Okay. And do you know if they can be tested, you know, at my place after they cross the state line?
Absolutely. And so a lot of it is just the genetics, the QQQR, and that's just a blood test, a blood draw.
Okay.
So we can't test for scrapie precision, we
Right,
test
yeah.
the genetics,
Mhm.
whether it's QQQR, whatever, and your vet can do that,
Okay.
yeah.
The disease, last couple summers has been killing antelope. EHD or
EHD.
EH.
Yes.
Is that, can all ruminants get that disease or?
So thank you for bringing that up. So EHD, epizootic hemorrhagic disease, or blue tongue, what we see in the antelope typically is going to be in the northwest or western side of the state, as you know. That
it's in
is,
Central.
yes, it is transmissible to livestock, primarily sheep are the biggest risk that we see with that, but it can also affect cattle. There is not a vaccine for it. The biggest thing is to keep them, to mitigate that risk. So mosquitoes are a big vector when it comes to transmission of EHD or blue tongue. For example, if you have your sheep or cattle grazing around a sprinkler system, irrigation system, you want to separate that during EHD season because of the mosquito risk. But it is transmissible to livestock. And so we also ask that if you see antelope, dead antelope or dead deer on your premise, that you contact Game and Fish, and they will come and test those animals for EHD at no cost. We will come and test your livestock at no cost. Yes, and that is a
I think we
risk
lost
mitigation.
some livestock. They're around water holes
Exactly.
where it happened. You know, one was a bull and 2 cows.
Yes.
And it was right then when all these antelope were dying.
And we'll come and test those animals at no cost. Just let us know. And typically we coordinate with Game and Fish. We usually come in about the same time and they'll check the wildlife and we'll check the livestock. Yes. One other thing that there isn't a treatment for, but it's a risk factor. Any other questions? Yes, sir.
What disease is a big concern relocating bighorn sheep out of the Sweetwater?
That's a day's topic. It is. Mycoplasma are a concern. That's the biggest concern we have is mycoplasma. Actually, in bighorn sheep. That's the number one, is mycoplasma. Respiratory diseases. That's our biggest concern.
And what's your opinion? Should we keep them out of there or replace them with bighorn sheep?
The sheep or the, keep which out? Which out, the bighorn sheep or our sheep?
The bighorn sheep.
There are mitigation factors we can take to prevent spread of disease. We just need to identify what those factors are and see if we can do that in that area. You're not gonna get a whole definite answer from me on that one. But it's to mitigate the risk. And it depends on the situation. Can that Sweetwater area that they're looking at, can it support those bighorn sheep? That's my concern, is can it support those sheep? Okay? If the answer is yes, then how can we mitigate the risk to our livestock producers by having them there? And are they going to stay there? If it can support them, they'll stay. We need to make sure that it can. And I'll leave it at that.
And there's already been some there. They have pictures of them in there.
I've seen them there all through the years. They've always been on the.
They can say whatever, but they're there.
The question is, are you willing to live with the mitigation efforts? That's the real question. Are you willing to live with the fact that they're not gonna let you turn out early enough because they're lambing? Are you willing to live with the fact that you gotta move more often, different things? And so that's, there is mitigation efforts to make it work, but are the livestock producers willing to work back and forth to make that happen?
It impacts more the lease type agreements than it does anything else, as you were talking.
And the sheep have never survived in there.
And I don't, I've read the history, I've been a part of these conversations. I always wonder if, if you go back in history, is that typically a bighorn sheep region? Right there. I don't know that answer for sure, but
Well, and it could be
thank you.
the type of sheep that they brought in too.
Could be. You have to bring sheep that are already acclimated to that kind of
You need more
environment.
of a desert sheep.
Correct. And that's what they're focusing on doing if they do bring them back in. That topic, CWD, those are topics that we could be here for days.
Yeah.
Any other questions?
And it might be a dumb one, but what is an area vet?
What is an area vet? An area vet is a veterinarian who is in charge of a specific region. And that can be a western Kansas, western Wyoming region. It could be an entire state. Area veterinarian in charge means they're in charge of that entire state.
But so, you're the state vet, are you also an area vet?
Area veterinarian refers to USDA.
Okay.
So we work with USDA Veterinary Services. We work hand in hand with them. And that's what their designation is an area veterinarian.
I had never heard that too.
Yes, it's their designation. Yes, sir.
What's your thoughts on the federal government moving that lab from the island in New York to
From Island in Manhattan?
Kansas?
As long as the biosecurity is in place, we'll probably be fine. And here's the reason I say that. That we have an animal health corridor now in the Midwest. It's kind of around that St. Joe, Kansas City, that region. With all the mitigation steps they have in place, I'm okay with it. Also because of the labs that are in the area. Not only that, but there are other labs now that also have the capability of doing disease testing beyond just Manhattan, Kansas, that aren't advertised as much. Have you toured the building by chance? If you're ever going through Manhattan, Kansas, I encourage you to go tour the building, tour the facility. It bothered me tremendously, and my son's a K-State graduate. I lived in that area for a long time. It bothered me for a long time. But when you go tour the facility and you see how it's set up, that risk does decrease a little bit. I guess that's what I would say. I'm sort of okay with it now after seeing what they have in place. I'm better with it.
Still scary.
It is very scary. I will not deny that. When you have a tornado come through there and you have foot-and-mouth cattle sitting in there, very scary.
I just want to see why they pulled it off an island that's so much easier to contain.
It's cost. It's all about cost. And I will tell you, I was able to do a lot of work on Plum Island with USDA, and it wasn't unusual for some of the deer to have foot and mouth lesions on the island. And they figured out why, where the contamination was occurring. But yeah, it's scary. But it was contained because it's an island. It's all about money. That's what it's all about. But I would encourage any of you that go through Manhattan, Kansas, to go through and take a look at that lab. It's worth it to me. It's not let me down, but it's worth it to you. So I'm better than I was. Any other questions? I know I'm being told we need to wrap it up, so thank you guys for listening to me. I appreciate your time today.